Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Today I'm going to talk to you regarding cervical pneumatic traction collar. It is very useful collar whenever you want to track the cervical spine, and normally the cervical traction is needed in disc herniation, prolapsed disc, compressed disc, and sometime in severe neck pain, which can reflect in your hands and forearm. There any pinching of nerves, and there's any very stable compression fractures, to immobilize the neck and to tract a little bit to give relief to the cervical spine and the disc. It is a very useful device. So this is a cervical traction collar. It has 3 chambers, and then it has got these inlets, and this is a pneumatic pump. So this pneumatic pump has also 3 pneumatic valves which you have to insert into the collar, and you make sure they are fastened properly. And so we attach the pneumatic pump to the cervical collar. Then you wrap it around the neck, and you make sure that you secure the collar position through these Velcro straps. So that means the collar opening is just underneath your shin bone. So make sure that when you inflate the collar, or when you intended to use the collar, that you are very much static, you are not moving, and you are staying very stable, and you just stay in one position, so then the traction can be very much effective. So once you feel that you are ready and the pneumatic pump is attached to the collar properly, then you can start inflating the air into the collar. That means that this pump you need to compress. So you will see now the collar is expanding, and I feel a lot of pressure on my shoulders, underneath my jaws, and I feel that someone is pulling my head up, sitting on my shoulder, and my neck is really relieved. In fact, getting stiff. So if the collar is too much close to your neck, it may cause some suffocation. So it has to be reasonably tight on your neck, and then inflate the air to the extent that you feel that your neck is offloaded from the weight of your head, and you feel really tracted. Yeah, that's enough. It's very much enough. So you may opt to, if you want to adjust the air amount, then you can press this knob, adjust the air. Otherwise you can inflate more. If you don't like this hose, this pipe, the air pipe, then you can just remove it. So this is removed, so you can stay with the collar without the pneumatic pump, and you can sit like for half an hour to 45 minutes. Sometimes it becomes very difficult to sit for a long time. Then you can gently move, and you can perform some very normal activities. It is recommended to be used for 45 minutes, twice in a day, one time before you go to bed, and second time you can choose any time, but most probably morning is the best time. And when you want to remove the collar, you can simply, there is a knob, you can press, the air will go out, then you can remove the straps, and you can remove the collar. I already feel very relaxed with this collar. So this collar, it comes in 3 chambers as well as in 2 chambers, depend upon the neck height. So you can recommend to your patient who are intended to have some traction at home. This is the best device to be used at home, because the patient can really use it by himself or herself, and you can adjust the amount of time and duration, but it's very result oriented and price wise cheaper. No need to take appointments and to visit clinics once you are really familiar with the system. I wish you all the best.